But that was life, and now it was time to go to work. And if you don't think a doctor's appointment is work, then you're either not sick enough or you're not giving proper credit to the fact that this relationship could change your future and your life. So let's say you do that. Now what do you do? What is your job as a patient going in? All week we've been talking about, we're talking about empathy, we're talking about communication between providers. There's been a lot of people offering, concerns and hope for the future. I'll tell you how I built relationships, because when I was in the social movement organizing masterclass, one of the things they held up as important was modeling. So your first job is to stay cool. Doctors are going to tell you things, and you're going to flash. My poor mom would do this. I found, everybody has moments. When someone says you have cancer, you go, ah! Your job is to stay cool. I'm in the hospital. I have both of my adrenal glands at one point. I'm in the hospital, and they want to see, while they're checking me out for staph infections and horrible things, they also just want to see if I have adrenal insufficiency, because I have some weird symptoms. And so the first doctor comes in and he says, your levels were low, you have adrenal insufficiency. And then he leaves. And 4 hours later, the next doctor comes in and he says, your absolute level was low, but your increase was normal, you're probably fine. And then he leaves. And those are different. And then the third doctor comes in and he goes, good news, your adrenals are fine. So that's one day, same test, same hospital. These three guys are having lunch together. They're talking in the hallway. And they gave me 3 different answers about what my future would look like. Your job is to stay cool. Your job is not to overreact. How would I have handled that as a usual patient? I'd have spent 4 hours freaking out. Then I'd have spent 2 hours confused. Then when the guy came in and gave me good news, I'd have said, what kind of ship are you running here, dummy? What are you doing to me? Instead, I had a job to do, and my job of getting my health back and staying on the medications that were saving my life had nothing to do with yelling at a guy about a test. So I just stayed cool. And the other thing is your job is to slow down your decision-making process. Every part of the medical system is designed to put pressure on you, from bright lights to beeping to people who are hustling. It's all about that. I was watching C-SPAN once, and I heard a fighter pilot talking about the OODA loop. I don't know if anyone has ever heard of this, because we have researchers here and pharmaceutical company folk. Observe, orient, decide, and act. The fighter pilot explained his job. His job is to speed up your decision-making loop, to put pressure on you, to speed up that loop until you make a mistake and then he can kill you. That's what a dogfight is. And I realized if you are under pressure and you speed up your decision-making loop, you can make a mistake. And that mistake could be a lifetime of results. The truth is, in very few parts of medicine, Dan said there were 17 days between diagnosis and treatment. That is not 17 minutes. It is not a heart attack. It is not, blood not making it to the brain. There is time to slow down. They want you to make the decision now because they have more people to see. Your job is to make sure you don't make a mistake that you can avoid. Your job is to slow down the decision-making process. The next part of your job is to understand what a practicing physician does. What do they do? If you ask them to do something that's not what they do, you're not going to get the result. So the truth is, a practicing physician's job is to treat as many patients as possible with the means and methods available. Just like Ed's story told me, if you want something different, you're going to have to do something different. There's no front door to research medicine, but if you realize that specialists can't give you the answers you're seeking, you're going to have to think about it. And if you ask a practicing physician in the office visit to do something that's not their task, you're going to have a hard time. So what are practicing physicians doing? Are they saving lives and devising treatments and doing all of these noble things that sort of bring a tear to your eye in a Hallmark movie or something? What doctors are really doing is making one decision. Everything you say to them and everything they hear is related to making one decision. Do I treat? Do I advise? Do I refer? They are action-oriented listeners, and they are listening to make that decision. And it shapes every other part of the appointment. And that's okay, but that's what they're doing. So now, what are the rules of the game, right? When you're in this doctor's office visit and you're a patient, what is the doctor thinking when they're interacting with you? They follow a set of rules, and these rules make the office visit, these are the rules they use on everybody. And if you want something different, you're going to have to do something different. So what are the rules? Then we'll look at how I change them, just slightly. Simple is necessary for compliance. Compliance is necessary for success. Non-compliance is common. I commonly encounter problems. I rarely encounter rare problems. The standard treatment works on most of the folks most of the time. If it doesn't, we'll try another option. If that doesn't work, we'll refer them. If it's a tricky case, we'll refer them to someone else. So my condition was rare, and you can't just keep sending me to people because that takes 4 months. I can lose years as people walk in having done no homework and realize this one's unusual. So I redefined the office visit, and it was a small redefinition, but it was easy to pass on, and it changed everything. I did 4 things. Doug doesn't always fit the model. Now, when you get a blood test, or when I go, this medication's making me keyed up, and they go, usually makes people tired. Instead of that being like a challenge, like I'm not right, they're saying, they say Doug doesn't fit the model. And it's not a roadblock. It doesn't mean we're done, but it keeps us moving. Doug has well-researched ideas. With Doug, we often ask why and why not. And compliance is not an issue with Doug. If complicated works best, we do complicated. So how long does it take, once you've got this redefinition and you've built this new relationship, by not bringing baggage from the past and by sort of helping people understand that you're the zebra, even though they usually see horses, how do you communicate that? This is what it sounds like in the hallway where you're not. This next patient, this is the one that shows you that they don't always fit the model. You've never seen a patient who's done research like this. His case is rare. We slow down and we have to think about why we're seeing what we're seeing. And why is this patient on Q6 instead of 4 times a day, instead of twice a day? With this patient, compliance is not an issue. Q6 has gotten better results for him, so we do it. These are simple one-sentence explanations to teach the game to the next doctor. And they create a situation where you can get results if you have a rare condition. Just like they were saying about clinical trials. I didn't need to change everything. I didn't need to lecture everybody. I needed a slightly different game. It looks and feels just like the regular office visit, but when they say it usually makes people tired, they're not saying, I don't believe you. They're saying, Doug doesn't always fit the model. So that's your job if you're a patient, is to do all you can to work with them and get the results. You're the one who's sick, and you have to find your processes that work for you. If you need confidence that the surgeon knows how to cut before you go under, you should seek it. And if you need a slightly different office visit, your goal is to help communicate that when you can. I know it usually makes people tired, but I'm feeling tense. I certainly have a weird condition.